The behavioral model of depression. These notes are taken from my summary of treatment plans and interventions for depression and anxiety disorders. To begin with, depression is perceived to result from repetitious, passive, and unrewarding behaviors that reduce rewarding opportunities. According to Foerster's 1973 operant model, depression was due to the inability to obtain or a loss of rewards, which leads to difficulty in obtaining reinforcements from external contexts and relationships with others, according to Zettel, 2007. Behavioral activation requires the use of a functional analysis of behavior to identify certain behaviors that reinforce depressive symptoms. This therapy focuses on activating more predictable and rewarding responses that helps increase the contingency of behavior and reward, according to Martel, Addis, and Jacobson, 2001. This is particularly useful for individuals who struggle to predict and control outcomes. First, a functional analysis is conducted to identify, rank, and tally behaviors that are considered more rewarding, and these are also listed out before being assigned behavioral assignments that are used to increase the number of rewarding behaviors present. These are known as activity scheduling and reward menus that aim to increase the frequency and intensity of the rewarding behavior. From this perspective, depression results from poor problem solving, a focus on skills deficits, sleep deprivation, a lack of assertion, lack of self-interest, and exposure to adverse situations, use of self-punishment, and the non-contingency of behavior and outcomes, according to Nezel, 2004. External factors like the presence of adverse and stressful life events, childhood difficulty, increased interpersonal conflict, a loss of a job, divorce, separation, a change in financial status, and moving to a new place, state, or country are all predictive of depression. Acceptance and commitment therapy, ACT, was developed by Hayes and colleagues in 1999, which emphasizes an acceptance of the situation as a matter of fact, and it identifies creative hopelessness, where previous attempts to feel better have failed, but still hones in on creative, flexible responses that show a willingness to change. This reduces the need for avoidance of unpleasant feelings by fostering tolerance for it. Depressed individuals need to learn appropriate social skills and assertiveness, as a lack of assertion of one's own needs can produce an inability to obtain rewards, greater non-rewarding aggressive behavior towards others, and helplessness. Problem solving also needs to be taught, which the individual needs to 1. Identify the problem. 2. Collect information about the problem. 3. Brainstorm possible solutions. 4. Rank, order, and compare the solutions with each other. 5. Experiment, execute, and plan the solutions. And then 6. Afterwards, evaluate and revise the plan if needed. The behavioral model is a good way to address the various behavioral deficits in depression, as distinctive behavioral precursors are assured, and in increasing the frequency and contingency of rewards, depression and depressive symptoms can be reduced. Thank you very much for watching about the behavioral model utilization in treating depression. Bye-bye.